On a previous video, we spoke about golfer's elbow, pain on the inner elbow, but a condition that commonly gets mistaken as golfer's elbow is cubital tunnel syndrome. Also presenting with pain at the inner elbow, however, the two are very different. We're going to explain why and talk about what exercises are best for cubital tunnel, along with things you can do to help and what other options there are if they're not helping. Golfer's elbow is to do with the common flexor tendon, and all pain is mainly felt around that medial elbow and normally worsen with gripping activities and activation of the muscle and tendon of the forearm flexors. Cubital tunnel, however, is an ulnar nerve issue, and where some of the pain may be felt on that medial elbow, it can also commonly be felt down the forearm towards the hand, and more specifically towards the little finger. This can feel like a burning pain and commonly associated with pins and needles. And instead, this is usually worsened with bending and straightening of the elbow repetitively, leaning on the elbow, and prolonged flexion of the elbow. It's caused by compression of the ulnar nerve at the elbow. An important distinction that needs to be made is that the compression is actually at the elbow. The ulnar nerve will travel from the neck down the arm into the little finger. So it's important to get this checked out by a professional so they can rule out the neck being involved and that it's just at the elbow. As well as exercises that can be done, the main help will be minimising the aggravating factors. If it's leaning on the elbow, then adjust position. If it's prolonged flexion due to being on the phone, for example, get a headset. This will come first and is most important. Then you can work on the exercises, and here's some that can help. Exercise number 1, the light bulb. If you have a cubital tunnel, it does mean this ulnar nerve can feel tighter. So a lot of these exercises work to stretch this nerve, which can be done by adjusting the little finger position. The first exercise is more gentle and a great starting exercise to determine tolerance. Just like muscles, you don't want to overstretch as that can cause more pain. You want to gently tease it. So start here and gradually progress. For this exercise, bring the arm out to the side with the elbow flexed at 90 degrees. You will turn the little finger towards the head and then back again. It's kind of like you're changing a light bulb. This is a glide of the nerve on and off rather than a constant tension, which you might find more aggravating. You want to make sure this isn't bringing on any increased pain or pins and needles during or afterwards. If it does, don't turn the hand as much so the little finger isn't coming as close to the head, so there's less tension. There's also a move you can do to intensify or make each of these exercises easier, which we'll discuss shortly. If you find that you improve on this well and it's starting to feel much easier, or when first doing it you just don't feel anything, then move on to exercise number 2, the smoker. This progresses things slightly as it increases the stretch on the ulnar nerve. Again, you'll be gliding this on and off. An easy way to remember this is to imagine you're smoking. For this setup is having the arm abducted out to the side and the elbow flexed at 90. You will then bring the hand towards the face while turning the head towards the hand. Have the thumb and index finger touching while moving it towards the mouth. With the palm faced up, add that stretch of the little finger. Same thing applies as the previous exercise, no increased pain during or after. If looking to progress this one, then move on to exercise 3, the eye mask. This will add a further stretch. Now you're going to be keeping the index and thumb together, but trying to rotate your hand to your face so your eye is looking through it. And your little finger is fully pointing down by the side of your face, and therefore adding full stretch to the ulnar nerve. If managing to get this step, you're likely at the later stages of doing well with symptoms. If it's too hard but the previous exercise is too easy, you can do in between the two and gradually progress. So the way you can adjust all of these exercises to make it harder or easier and increase the glide is moving the neck. So basically stretching the nerve at the other end. If you move the neck away from the arm, this will increase tension, and if you move it towards the arm, this will decrease tension. What you don't want to be doing is tensioning from both ends, as that's likely to be too much. However, you can move the neck as you move the arm. This already is happening in exercise 2 with rotation, but it's increased more with side flexion. So you can move the head away as taking tension off the little finger, and then towards as you put it back on, like a floss. And you can do this for each of the exercises. Another thing you can implement to help is an elbow splint to keep the arm in a straighter position and stop that deep flexion of the elbow, or at least make it harder to do to remind you not to do it as much. This is especially useful if that deep flexion is one of your main aggravating factors. Now, if you've done everything you can, you've modified activity, done exercises, and it's just not getting better, or you've got really severe compression and have things like wasting in the hand, then surgery may become the best option here. It's actually a pretty big incision they do, so they can get to the point of compression and free the nerve. If it's a mild case, this is definitely not the first choice of intervention though. Really try and exhaust all the non-invasive with minimal side effects first. For further information on how to go about managing injuries, check out this video here, which talks about how to approach and progress rehab, including number of reps and sets, which will be extremely useful when approaching the exercises in this video to ensure that you're getting things right.